Intraoral cameras are so important to use throughout the entire dental hygiene treatment. As soon as the patient is sitting in the chair, you can show them areas of need, areas of treatment. And then after you provide the treatment, you can show them how much better the teeth look and the gums look. And you can monitor, you can, every appointment, you can show them how much healthier the teeth and the gums are getting and how much the patient is benefiting from the extra cleaning because there's less redness, there's less bleeding. And you can show this and document this with the intraoral shots every single time, even throughout the entire appointment as a hygienist. You can show staining and hairline cracks and why would it benefit to repair a hairline crack? Because you can show the structure of the tooth and how the cusp can break off. And if you use the intraoral picture, the patient will be able to see the benefits from the proposed treatment. Yeah, it's amazing how patients don't understand or don't know what a tartar buildup is. What is tartar buildup? Or what's gingivitis? I mean, we talk about this every day. If you show them the bleeding, the redness, and how much tartar or calcium buildup is on their teeth, and then you show them a picture after the cleaning, and all of a sudden they can see the ridges in their teeth, and oh yeah, I can actually get in between with my tongue and I can perhaps start flossing. Showing them before and after and what a big difference it makes will involve the patient, and they'll be really surprised. That was in my mouth. I had that much tartar. I had that much plaque, especially plaque. You can show the yellow-green discoloration on some of these teenagers that don't want to brush. We get it. But if you show them the amount of plaque that's 5 layers thick in a neutral picture, you know, they might think about it, and you'll explain, you know, this causes bad breath. You're 14 years old. You might want to start looking for a girlfriend and a boyfriend. You might want to start worrying about brushing and flossing. And intraoral cameras are an amazing tool to just put it out there without criticizing. In many cases, especially if there's a lot of buildup, the patient requires freezing. I sit them up and I show them the picture and tell them, you know, I really don't want to hurt you here. There's a lot of buildup. It's been sitting there for about 5 years. I am pretty certain we will need a little bit of freezing to get all of this calcium buildup around your teeth. You can see, we can't see the tooth. It's covered completely with a bridge of calculus. So if they can see it and they can understand that, yeah, I don't want the hygienist to hurt me. Maybe I want to be frozen, you know, on that side. They'll be more willing to accept the treatment because they'll see the benefit of not being hurt, but still getting the tartar off their teeth. Well, I always try to find one positive observation. I use the intraoral camera all the time. So if you can show the patient that they're doing such a wonderful job, that now they're causing abrasions, that they're actually removing enamel off their teeth because they're doing such a great job scrubbing, yeah, you want to show them. You want to use the intraoral camera because now they're doing such a good job, they're actually hurting themselves. So no, you want to use it on every patient, every time, educate them, let the doctor on board. I use it every day on every patient. I send a lot of my teenagers home with intraoral pictures of what their teeth look like before the cleaning and after cleaning to show them how much plaque is actually, even food, sitting around the orthodontic brackets. That picture speaks 1,000 words of where they're missing, where they're not removing. And yeah, it's amazing how a lot of patients look at that printout copy and they think, that was me? I can't believe that. Another benefit of using intraoral cameras is for insurance purposes. So many cases we send in for an estimation or predetermination and they come back denied. You take a picture of that broken cusp or that leaky margin or a tooth that's completely shattered to the gum line and you send it to the insurance company, they have no way of denying a claim that there's a broken tooth. Same thing with grinding. It's amazing how you can take intraoral pictures of a patient who's been severely grinding occlusal trauma that needs a night guard. Simple as that. You send it to the insurance company and you show it's a preventative measure. I documented it, I took a picture of the occlusal wear right down to the dentin, and the insurance company will have no way of declining. In many cases, we take intraoral shots of occlusal wear that need to be repaired. Same thing with abfractions. Same thing with incisal wear. So all these areas you can show to the patient before you even send a claim to the insurance company. The reason why you're restoring these teeth, the reason why you're repairing these teeth is because there is wear and tear, a lot of abfractions that we need to put that structure back on these teeth, and the patient will see the benefit why are you actually bringing them back for restorations. There's a reason for that. They can see it on the screen. They know that they will benefit from the strength on the sides of the teeth from grinding and night guards and crowns and bridges.